Hi, my name is Rosetti Hoffman, and I am an LVN that was part of the Project Echo. And my experience with the Project Echo has been really helpful with guiding my patient care. This program was phenomenal, and the knowledge that I gained from it really helped me develop as a clinician. The collaboration efforts that everybody provided along the ways was really good, and it was a great experience because someone from the network knew or can relate with what I was complications that I was facing, and they were able to put together those missing pieces of the puzzle that I didn't know or I lacked of the knowledge. So they were able to help gather that information for me and help me put those pieces of the puzzle together. The opinions and the expertise advice also was really an amazing experience. You weren't just getting opinions from someone that that you worked with or someone that was just giving an opinion. They were actually giving recommendations because they've either gone through it or you had someone, a clinician, a doctor that actually was giving recommendations. So this experience was really phenomenal. And because of all of that experience that I developed from it, and it helped me to grow as a clinician, I look forward to working with the TACL team again in the future. Thank you for your time.
Hello, everybody. My name is Dr. Alex Young. I'm a licensed health psychologist in the Dallas area. I currently work in two very interesting areas, both virtually. I'm going to be working at the South Texas VA down in San Antonio, and I also currently work for a gastroenterology practice that's virtual, providing integrated care. I also provide some private practice work, and I serve people and patients that have comorbid medical diagnoses, and sometimes that includes individuals that have HIV. I recently joined the HIV Echo as a hub specialist, probably a little bit before the summer of last year. And it's been a wonderful experience. To be honest with you, I didn't know very much about echoes before joining, but I've given a lot of presentations and I really like doing that. And I thought, well, maybe this would be a really good role for me. And so my experience has been a wonderful one, one that I just learn more and more every month. Listening to the different didactic presentations and learning about the different patient cases, it's really been eye-opening to me to see all the different resources the different communities have and all the different knowledge bases that everybody has, because so many people come to these echoes from all different walks of life, from all different areas, and there's just such a wealth of knowledge for patients and providers that need assistance on how can we help this patient, this case, this provider with whatever is needed. Being a hub specialist, I've been fortunate enough to present some education, being a psychologist, psychological education for patients that have HIV and providers that work with HIV patients. And that's been a really wonderful experience. You know, being a psychologist, I have a wealth of information that I've learned over the years, but even in doing these presentations, I've learned more. And so even in that way, I'm still learning through these ECHO presentations, my role as a hub specialist, and through my own presentations to this audience. So it's just been such a wonderful experience, and I'm so glad to be on this ECHO team and in my continued role. I ended up joining the HIV Echo again to learn more about this area and to help my patients more. Like I said, I do see a small subset of patients that have HIV or are prone to getting HIV. And these echoes have really helped me gain even more knowledge to help them learn about new things that are coming out as far as medication, insurance things that can be used to help patients access care. And for those people that are in rural areas, which a lot of my patients are, learning about what are other places that have rural patients, what are they doing and how are they helping their patients? And so for me, it's really helped me to share that information with my patients to help them advocate for themselves and with the practices that they're in to kind of figure out what options, what access points do they have in their areas. And so in that way, it's really impacted my practice kind of holistically and through education and information. What would I tell others about my experience in joining an HIV Echo is that there are just wonderful things. And I wish that there were more echoes. I wish that echoes were better marketed. You kind of have to know where to look. You kind of have to know where to find them. But there are a lot of them out there. And if you're not engaged in one, or you're just kind of, well, maybe I'm not too sure about it, give it a try, drop in, maybe stay for the whole visit, maybe stay for just half the visit, see what it's like. The echo visits are usually free for everybody, and there are many different places that offer echo sessions, UT Health being one of them, and they have some marvelous ones. But it's really a wonderful experience, and you get so much out of it, even through one visit. And so if you can, Google echo, Google something that you're interested in, HIV, HCV, or maybe another topic, and try it out, because it really is a wonderful experience. And if you find that you really like it, maybe you can also apply to be a hub specialist or a part of that echo team and contribute to the knowledge base and help patients and providers. Thank you so much.
Hi, good morning. My name is Diego Huerta. I'm part of the Westboro Clinic Valley AIDS Council team. We were part of the TACO project for a couple of years, and we really appreciated being part of this collaborative. As we took on new clients and assisted them with the treatment process, these monthly echo calls were really a great way for us to hear from other sites as they obtained clients that were in tricky situations, and we were able to obtain guidance from the professional team, so that when we were in these similar situations and when we had clients that that we wanted additional guidance, we knew that we could turn to the team for their support. With their guidance, we had access to pharmacists, licensed chemical dependency counselors, as well as other sites that were in the same situation that we were, as trying to take on new clients. We appreciated the work that the team did to help us, and we know that with their guidance, we were able to help more clients get access to treatment. Thank you so much for letting us be a part of this effort, and we look forward to collaborating in future projects. Thank you.
Hi everyone, my name is Maria Gutierrez and I'm the project coordinator here at UT Health San Antonio, South Central ADC. I wanted to just provide some feedback on the HIV echoes that I've attended. So I think that the HIV echoes have been a great experience. I think it is an amazing way to showcase the model and improving patient healthcare at the local and global levels. The HIV echoes not only offer a space for healthcare workers to think creatively and gain insight and best practices when roadblocks or barriers appear that affect their patients and communities' care, access to care. I think it's also a great opportunity to gather knowledge from different specialties in one place. Something that I've learned from the echoes is that a team-based care approach is essential for patients' overall health, and ECHO does an amazing job at showcasing this. It truly does. I think what I would tell anybody that is looking to join an ECHO session is join one. Join the ECHO sessions. Every ECHO session is different, so you can always expect to learn something new, whether we're learning about the new didactic presentations, and increasing your knowledge in a variety of healthcare related topics. And the case presentations truly offer a learning opportunity on familiar and unique experiences we may face when providing care to our patients.
Good afternoon. My name is Dr. Cortez. I'm an internist in Laredo, Texas. I work in a federally qualified health center. I'm seeing patients and I participate as the chief medical officer here. I heard about Project ECHO since the beginning of the career. I've been here for the past 7 years, and I've been hearing about this awesome movement, I will say, in the physician community. But recently I heard more about the hepatitis C Project ECHO in San Antonio through the education department, AHEC, here in Laredo. So, and because of the hepatitis C has been something that we want to start treating, that we want to start screening, it caught my attention even more. So I started participating with the San Antonio one approximately a year ago. I've been including in the sessions, participating in the lectures, listening to the lectures, but also reporting some of the cases that we have faced here. And it's been a great experience because it's something new to us as primary care physicians wanting to treat hepatitis C. And it gives us a really good tool to have that specialist report, right, on if we're doing it right or wrong, or like what way we should take in regards of this patient. Also, I really like from this Project ECHO, besides the lectures and that we learn more about hepatitis C only affecting the liver, but other aspects of the systems in the body, and also family members and how to incorporate the social aspect of these patients. So when we present the cases, we don't only have the great rapport from the specialists, but there's another group of professionals in the sessions giving us their perspective, right? Recently, when I presented one of the cases, I thought it was going to be straightforward case. Patient has hepatitis, he does some drugs, he's in treatment, and let's give the treatment. But it changed in the conversation, right? There were some recommendations on, okay, you should start the tapering down of benzodiazepines, and you should do case management this way, or you should try to contact the family. So it wasn't only the therapy for the hepatitis C, but the patient as a whole. That is what we want in medicine in general, right? But even more for these patients that are so complex. It's not only the disease. I will tell others about Project ECHO. I will highly recommend to participate. And actually, we partner with the San Antonio ECHO. So we are internal medicine residents in Laredo from the University of Encarna Ward can participate, so they can graduate already knowing how to treat hepatitis C and what to expect. So I will suggest everybody to join in the sessions, be ready to present cases, and be ready to learn. It's an amazing tool. It's a specialist on just a click in your computer. So that's great. Thank you.